Ruby Lee Anderson was discovered shortly after she died in a stairwell yesterday afternoon.
KPIX 5's Susie Steimle is live at the hospital with new details. Susie.
Well, the medical examiner just confirmed the time of 76-year-old Ruby Anderson's death is 1:26 p.m. yesterday. So we still don't know how long she was in that stairwell or what caused her death. But authorities are saying they could have done more to help her. The more we learn about 76-year-old Ruby Anderson's death, the more apparent it becomes it could have been prevented.
It looks like we need to do better.
Ruby Anderson died inside this power plant, steps away from world-class care that might have saved her life. Her body was found in a stairwell 10 days after she was reported missing, but no one thought to look for her here.
That's because she was not a patient. She was a resident of a board and care facility that happened to be on the campus. She regularly signed herself in and out.
Ruby lived inside a board and care facility on the hospital's campus for people with severe mental health issues. Because she was a resident, not a patient of the hospital, she was allowed to come and go. Steve Protzel, a doctor of pharmacology, says that's a policy he'd like to see change.
A family member or a social worker or a case manager would be notified, so they shouldn't be able to check themselves out without some oversight.
Records show the facility Ruby was staying at has a history of complaints dating back to 2014. Patients report being given too much Abilify and Haldol, which are antipsychotic drugs. Others say they were given the wrong medication, not provided meals, treated like they were in jail, and in one case, a staff member failed to seek timely medical attention, resulting in the death of a resident.
This should really be a wake-up call, and to be able to say, hey, we need to do something about it so this doesn't happen again.
The Department of Health says Ruby's death is prompting security reviews across campus, including closing the power plant to the public.
And we'll continue to do enhanced security assessments to figure out, are there additional measures that can be taken to prevent this from happening again.
Now, there was a similar case here at SF General in 2013, and that was the case of Lynn Spalding, a patient here who was missing for 17 days, and then she was found deceased in a stairwell. That case led to sweeping changes here at the hospital, but none of those changes applied to Ruby's case because she wasn't a patient. We're live in San Francisco. Susie Steimle, KPIX 5.